I would like just to comment shortly on the point. You make the point that farmers, at least I understand that in Indonesia they are not aware of contamination and things like this. I can share with you the experience from Vietnam. The reality is completely different. Farmers in Vietnam, they are completely aware of all this story of contamination, infection, and things like this. And for me, the painful proof there is, in fact, they just shortly in a garden. Sometimes they plant a pakso, a vegetable, where they don't apply pesticide and all this, growth hormone, etc. for the vegetable where they eat, so it doesn't look very nicely. You see, you even have insect and all these things there, and just in the next paksos, all these chemical apply and that go to the market. So and it happened very often in Vietnam. So for me, at least is context specific that we have this kind of thing.
China farmers produce goods for self-consumption and for marketing are different.
It's true.
Especially with chemical applications.
Yes. So we are not very different.
No.
Okay. So and last is the first point. The second point, before responding shortly, I would like to have a comment to Amon on the case of Thailand. You see, it's the context of Southeast Asia. I mean, I would say in the good sense that Thailand is quite special, because we have very much heterogeneous context of knowledge, economic development, etc. So the case of Thailand, I would say, is quite different compared to its own neighbors. If you took the example of Laos, Cambodia, or even Myanmar, and you go a little further in this, Vietnam, the context is so different, because we are much behind Thailand, and the success of Thailand in promoting all this health coverage and in terms of policy, etc. So you are much better than others. So for ASEAN Community 2015, the free trade agreements that you mentioned, like I'm personally from the region, I'm a little bit skeptical to see how all these things will fly together, because we are so different at different levels. So that is my comment to our Thai colleague. Now, for here, I have some information to respond to the question here. I start first with Robin. You see, the landscape approach for donors to go on food safety. That is a good idea. But I fear that is still another, challenge that we add up with what we are having at the moment. We talk a lot about, systemic approach, interdisciplinary in the room downstairs, so many things. So I think that we need to take this with kind of caution, I would say. Or if you want to apply this kind of new things in this kind of setting, we need kind of adaptation and things like this. This is my response. And now coming back to John, again, this link also to the systems. Thailand, China, Vietnam, Laos, etc. We are so different. And regulation is important, and that is the way forward for long term, I would say. If you look at ASEAN, etc., Vietnam, we have law, etc., but we don't see that it works at the moment. One day maybe it works, but at the moment I think that by there we need to do something for the informal market. So I think that what we are doing very simple, and that is I'm finishing with and responding to her. What would be the concrete action for that? So I just name one in Vietnam. In Vietnam, people eat raw fish, raw meat, raw blood of pork. And recently, you have a kind of outbreak. People systematically die from Streptococcus suis, causing very severe infection, and they die quickly. And TV, they run on this thing. And now, men, they really reduce significantly, and some people declare that they don't eat anymore this kind of food. So the communication, and again, it's come back to you about knowledge. Awareness is also important. So it's one of the things that it works in Vietnam. And I think that we can think about other simple things that can work in that kind of setting, but need to test and show that it works scientifically.
Yeah. Okay. Just to respond to the comment made by our friend from Australia, yes. Just to maybe emphasize a little bit more on our integrated approach in addressing these NCD problems in the region. Again, what we're doing is really assessing the vulnerabilities of these communities to their consumption patterns. And again, these studies have found that a lot of the food items they're consuming are pretty much very poor in quality. Now, I just want to highlight one study that was completed in Micronesia in terms of taking up diet change or shift in the Pacific. Now, there was a survey done by the US Navy much earlier, before, I think it was in 1940 some. There wasn't any NCD problem found at that time. But then in 1980s, with increased consumption of imported food, at this time, if you look at it, this is when the US food aid was already tumbling into Micronesia or the North Pacific. They found that from zero or low or very low to about 400 some cases of diabetic problems. So again, there's a direct link between diet and foodborne diseases. In terms of GMOs, in the Pacific, we do not have any capacity to do any research or production of genetically modified food. But again, I was involved in one study in Micronesia, North Pacific. The North Pacific, their main trading partner is with the United States and some, little from Australia and Southeast Asia. Again, about 80% of the major food that the people are consuming coming in from US are GMOs. So again, with no capacity to monitor or GMO impact on the health of the people, I think this should be a big concern for the Pacific Islands, especially with respect to the question on legislation and framework. Again, most of these countries in the Pacific, they still have weak legislation when it comes to food safety and food standards. So what SPC is doing with its member countries, we're now looking at what we call policy and framework legislation deepening, where we're assessing the impact of these existing legislations and policies. And at the same time, we're also conducting capacity building and assessment within the value chain, from farm production all the way down to the table. So we're very thankful of this funding from EU, where we're implementing this program in addressing the value chain, hopefully to address some of these food safety or foodborne disease issues. I must apologize that I didn't really get the question. Maybe we can...
Yeah, actually it's the last question of our colleague over there on my side. I didn't really get it. Maybe
yeah, so maybe we can have a side...
maybe side talk later.
Yeah. Thank you, Chair.
Inside event.
Okay, first I try to address your question about the evidence, could be distorted by the media or the political reason. I think you couldn't really avoid this in almost all the countries in this world. So especially for the genome-modified product, there's no evidence say that will harm human beings' health. But many people will say, is the time long enough to really justify that evidence? So once you add this in, it's become an issue. You couldn't really prove it's right or wrong. That's kind of, I think something, even in China, I think lots of people argue with each other. Right? Many people say there's no clear evidence it's harmful, but some people may say, how do you know? You even could be intergenerational effect. Then come back to think about this, how you really, even for something there's clear evidence, I think it's still you need some sort of momentum or maybe placed strategically to really advocate for it. I think even like at the CDC, when I was working at the CDC, even in the US, I think the leaders or the the different centers, they always emphasize that, it's not every day you can do something, even there's a clear evidence. You still find a good timing and play it in a long kind of a strategy to pursue your goal. So I think that there's no easy answer for that. I couldn't really find a clear, easy answer for that. But at the end, in terms of research evidence, it's pretty clear. But once you included contextual conditions and experiential evidence, then you somehow still need to understand the prevalence and the value of the local and national stakeholders. So that's one thing. Second thing is I was trying to see if I can say something about John's questions about the local market. I think in China, if you really try to ensure the food safety issue for local market, I think two things we really need to do. Firstly is build a retroactive system, because if you don't know where the food is coming, we have so many small farmers and middlemen, you even couldn't really trace back who caused the problem. I think lots of people will take the free lunch. So I think that's one thing. Then second is the enforcement of the regulation, or maybe even the punishment. We always talk about, we have sometimes in many places we have good regulations, but you never really enforce it, so nobody really take it seriously. Let me give an example about, now China, you couldn't really drive after you drink alcohol. Previously, I think almost everybody did that. But once they have a very strong enforcement, if you do it, you got a really severe punishment. I think now if you go back, ask Chinese people, I think 99.9% of people wouldn't do that. So that's just my sense.